My name is Gina Ravelas. I'm the Senior Manager for ASC Billing and Collections for NVISION Centers. So NVISION has been around for, I'm going to say about, 15 years. And we're a company of 89 clinics and 9 surgery centers. So the different surgery centers some have been in business for 15, 20 years, while others are newer surgery centers, just under 5 years. But for the average, it's about 10 years. I've been with NVISION going on 2 years now, and we've been using HST from when I came on board, using HST practice management system. So we use it for our practice management, our revenue side. We're using an older version of HST when I started. And then once I started with HST, I became a super user with HST, a certified super user. So then we went on to go ahead and upgrade to the latest version of HST, and when implemented it to our other centers that were not on HST. So they were then implemented 6 months now, and then the last three centers are just maybe 3 months old. It was really hard to manage the other centers when they were on different systems, and of course different versions, older versions of HST. So trying to get them all implemented so that we were all on the same system, so that we could support the revenue cycle of it, aspect of it, for scheduling, for everything from insurance verification, that we were all on the same practice management system. That implementation, getting those sites on the buy-in from the different centers to use the system HST. It took a few months to get them accepted the buy-in, but once we did and implemented it, the training aspect of it has just made it so much easier. Now when we're doing the reporting, we're working our revenue, our AR, it really has helped us a lot. Managing those centers on just this, having everybody on the same practice management system. Chaotic because I had to know, okay, well, this center is on this system, okay, and this center is HST. Oh no, this center's on this other system, and some of them were very older systems that they were using. Other centers didn't have anything, a system that they were using that was I hadn't even heard of. But going on with HST after looking at it, playing with the system, getting more familiar with it, with the reporting and the more the training, the webinars, it just became so easy for me to say, it's easy for us to just all be on the same system and kind of streamline all our processes. For scheduling, from, like I said, insurance verification, it just made everything so much easier. But I did most of the implementation as far as the configuration for the centers, from the insurance, the library, exporting the data into the system. We did have a lot of help from IT on HST side with that implementation. But yeah, it was putting everything together for the different centers, all that information with the physicians, adding those in there to the nursing staff and everybody into HST. So that rollout, it was a process, but we did it as a team. It was a team effort. Well, like I said, as far as for the reporting for our metrics, our benchmarks, within being on HST and the same practice management system for all our centers. So now I have some more visibility as to what all the other centers are doing and how we're doing as far as our AR. Keeping that control over that AR has just made it so much easier because, now I'm looking at just one report for all our centers versus as all these different reports, trying to manage those reports to kind of be similar to what we have on HST. It just made it a lot easier. It's not as cumbersome. Having all these different reports. Now it's just, our analytics team has just now the reports that we have off of HST. So I've worked with other systems in the past from all the other centers where I've been on that have a good, robust reporting system and stuff. But I think that, from what I was seeing on HST, I do like the reporting on system. To me, it's user friendly that I can use. And if there's something in the reporting system that I just don't understand or something, I have no problem picking up the phone, calling support or HST support, and they're very helpful in trying to help us find out what report would best, fit for what my needs are. I think it's user friendly. The support that we get from IT support has been great. I do like the scheduling feature of it. It just makes it easiest. The scheduling feature keeps us, with our times for our centers. It helps keep the doctors on time when we do this the scheduling for the cases on that. But overall, I think it's user friendly, and it gets us some great reports out of it. The day-to-day has changed. It's been a huge improvement because we weren't using Document Central when I first came on board. And because most of our centers, when I say all our centers, are still on paper chart. So the fact that, instead of us getting one big batch, when my billing department would post those charges, we now go, straight to Document Central because everything is on there. Everything is uploaded, insurance card, insurance verification, the audit report. So it's helping them code and be more quicker at getting those claims out within that 24-48 hour turnaround time. So it has a huge impact on the fact that, we're now able to send out those claims out within those 24-48 hours in order to get paid faster, instead of having to wait for someone to sit there and scan a batch, send it to us, where they have it or not. They're just scanning everything right then and there as the patient's checking in, as soon as they're done with the case. And it's just made it more efficient. So, and to me, that is just one huge improvement. It's night and day. I've been able to maintain my AR under my goal, which is, over 120 day to be under 15%. I've been able to maintain it, between the 9 to 10% overall in the 120 day AR overall for all 9 centers, which has been phenomenal. Huge time saver, because like I said, our billers are able to get the claims out a lot quicker now using HST, going through Document Central. So that has been effective. I think that it's reduced the time that they've had to spend looking for, the batches or stuff like that, where they can just now go into Document Central. So that's been a huge time saving. So now it's allowed them to help us out with more working with any like denials and stuff like that. The workflow in the practice management system is another tool that has been very effective for our insurance verification team, to authorizations, to the collectors working that workflow view. So which also been a huge time saver for us as well.